Hello everyone. Today, let's talk about toddlers and preschoolers. So, what is toddler and preschoolers, and what is the role of nutrition during this phase? For toddler, they are each range between 1 to 3 years old, while preschoolers range between 3 to 5 years old. Let's move to the role of nutrition. First is protein. It is involved in building blocks of body tissues, repair and maintain vital tissues and organ growth, and produce hormone, enzyme, and immune cell. Second is fat. It helps the brain and nervous system develop normally, supply food for the body, and absorption of the vitamin A, D, E, K. Third, calcium. It helps to strengthen bones and teeth. Calcium also required to achieve peak bone density and reduce the risk of getting osteoporosis. Fourth, fiber. Fiber can reduce the risk of getting heart disease and obesity, and also aid digestion and prevent constipation. Next, iron. Involved in production of blood and building of muscles. In blood, iron transport oxygen in the body, and for muscles, it helps to store and use oxygen. For vitamin C, it is involved in formation and repair red blood cells, bones, and tissues. It is also boosts up immune system in the body. Vitamin A is good for eyesight, skin, growth, and immunity. For vitamin D, aid in calcium absorption to strengthen bones and teeth. Next is vitamin E. Vitamin E can boost immune system in the body. Lastly, vitamin K. It can aid in blood clotting process in the body. Let's move to growth and development among toddler and preschoolers. For physical development, first 2 years, they tend to gain about 3 to 5 pounds, and 3 years and above, there is not much changes because focusing to development of strength and coordination. In first 2 years also, they tend to gain 3 to 5 inches. 3 years and above, not much changes due to focus on development of strength and coordination. At age 3, all primary teeth has grown, and at age 4, they achieve 20 per 20 in their vision. We also can refer standard growth chart from WHO for children, boys and girls from birth to 5 years old. Now, let's talk about development of toddlers. Fine motor development. First 2 years, they started to lift small objects or pick them, attempts to feed things, and remove lid and covers from containers. 2 to 3 years old, they eat meal and drink by their own, recognize name, musical tunes, and can draw simple shapes, lines, and curves. Gross motor development. First 2 years, they are able to stand and walk, throw a ball from standing or sitting. 2 to 3 years old, they can climb up and stand on the chairs, kick a ball, going up and down the stairs, and use toilet on their own. Cognitive development. First 3 years, they learn to recall and memorize better, recognize color and faces, and able to tell short stories. Social and emotional development. First 2 years, they show terrible to signs, and at 3 years old, they have strong family bonds and feel guilty when doing mistakes. Now we will talk about development of preschoolers. Fine motor development. 3 to 5 years old, they can self-dress, use scissors and cut straight line, and also manage cutlery neatly when eating. Gross motor development. They are more skilled at running, paddling a tricycle, and hopping on one foot. Cognitive development. They can group and match objects, organize material, frequent ask questions, can tell their name and age, and also plays with words. For social and emotional development, they started sharing toys, show understanding right or wrong, compare themselves to others, and develop friendship. Now, let's continue to nutrition recommendation. For protein, it is recommended to eat animal-based protein, plant-based protein, and avoid any processed meat. Daily requirement intake should be 12 grams for toddler and 60 grams for preschooler. Next is fat. Make sure to consume more polyunsaturated fat, eliminate saturated fat and trans fat. This is the fat daily requirement intake for toddler and preschooler. Third is fiber. It is highly recommended to eat plenty of vegetables and fruits, as well as whole grain carbohydrate. For toddler, the requirement intake is 19 grams, and for preschooler is 25 grams. For calcium, the best source is dairy products. However, fat-grade vegetables also may have calcium. For calcium, toddlers should take 700 mg, while preschoolers 1000 mg. Next, iron. For heme, eat animal-based food, and for non-heme, eat plant-based food. Both toddler and preschooler should take 6 mg of iron daily. Now we will talk about vitamin. First, vitamin E. Make sure eat animal-based food and vegetables. Daily requirement intake for toddler is 400 microgram, preschoolers 450 microgram. Second, vitamin D. Eat natural food, fortified food, and remember to have some sunlight exposure. Both toddler and preschooler need to take 50 microgram of vitamin D daily. Third, vitamin E. For vitamin E, it is essential to eat vegetables like broccoli and also eat nuts and seeds. Daily requirement intake for both toddler and preschooler is 5 mg. Lastly, vitamin C. Vitamin C can be obtained from vegetables and fruits like mango. Both toddler and preschooler will be required 30 mg of vitamin C daily. Next, common nutrition-related problem or challenges during toddler and preschoolers, and also recommendation. First, food hypersensitivity. It may cause either by food allergy or by food intolerance. Food allergy, or known as allergic food hypersensitivity, is an immune system reaction when the body reacts to allergy-causing food with an abnormal immunological reaction. For the cause, a sensitive child must be exposed to the food at least once before developing a food allergy reaction, where they could be sensitized through breast milk. Second time after consuming the same meal, allergy symptoms may be appear. The symptoms begin within minutes to an hour after digestion include vomit, diarrhea, hives, itching or swelling of the lips, tongues or mouth, and difficulty breathing. Food that can trigger allergies, most common is milk, soy, egg, and wheat. Most severe reactions are peanuts, tree nuts, fish, and shellfish. Diagnosis is skin prick test. A little bit of food applied to a person's back or forearm and use a needle to pierce the skin. Presence of allergy indicated by a skin reaction. Food intolerance, or known as non-allergic food hypersensitivity, happens when I have difficulty digesting certain foods. It is different from food allergy as it does not involve the immune system, does not cause severe allergic reactions, and does not show on allergy testing. Reaction may be triggered by substances which are naturally found in foods like histamine and salicylate. These foods have similar reaction to food allergy, such as hives and skin rashes. Enzyme deficiency like lactose intolerance will cause diarrhea, wind, and stomach cramps. Diagnosis is food monitor. The best way of diagnosing a food intolerance is to monitor your symptoms and foods you eat. See what happens when you cut out the suspected food for a while and then reintroduce into your diet. Manage food hypersensitivity. Avoid the food that trigger the symptoms. Some toddlers with food allergy will need to avoid the food completely. Meanwhile, toddlers with food intolerance may consume small amount with no harmful effect. Therefore, it is crucial to understand which food to avoid, to read food labels, and how much each food to avoid. With the correct management, symptoms should be resolved. Second, iron deficiency anemia. Anemia is associated with poor cognitive and motor development, poor work capacity, and lack of iron. Not have enough hemoglobin that allows RBC to transport oxygen to other bodily cells. The causes are low iron diet, where body absorbs just small portion of the iron. Next, body changes during growth spurt need extra iron to produce more RBC. And lastly, blood loss as it can decrease the iron. Symptoms are pale skin, irritable behavior, lack of energy, and fast heartbeat. For the diagnosis, simple blood test showing with anemia will have low hemoglobin hematocrit, low mean cellular volume, low ferritin, low serum iron, and low iron saturation. For the treatment are eating a diet with iron-rich foods. If the child does not eat meat, mothers should add oily fish, eggs, and green leafy vegetables in their meals. They also need to consume vitamin C to help the body absorb iron from food. Third, tooth decay. The causes are poor diet and dental hygiene, eating high sugar food and thus not brush your teeth often. Second, dry mouth. If the salivary gland do not create enough saliva to wipe away plaque and germs, plaque and acid build up, increasing the risk of tooth decay. Third, baby bottle. Happens when they fall asleep with a bottle of milk, juice, and formula. Symptoms are toothache, brown, black, or white spots in the tooth, bad breath, and unpleasant taste in the mouth. To avoid tooth decay, remember to use fluoride toothpaste. They also need to start regular effective tooth brushing. Next, avoid any sweet drinks or can dilute them. Lastly, give only plain water at night to toddlers. Fourth, picky eaters. Picky eaters when a child refuses food often and eat the same foods at big in toddlers and preschool years and appears at the age of 1 year. So, how to handle? First, parents' role. Parents should eat a wide range of healthy foods, prepare meals together, and avoid showing disgust or disinterest when trying new foods. Toddler is sensitive to the taste, smell, or texture of the food and introduce new foods gently but regularly. Keep track of toddlers' food sensitivities and keep them in mind when cooking. If toddler is simply less likely to try new things based on your temperament, list new foods beside foods he already enjoys. Encourage him to try by touching, smelling, licking, or tasting it. Cross-cultural influence in nutrition during toddler and preschoolers. First, Japanese culture. In Japan, kids eat anything served by the parents. They are taught to refrain from snacking, and grueling stomach is expected to be normal in Japanese kids. Based on their tradition, they should walk away from the tables only after feeling at most 80% full. Thus, Japan has the lowest childhood obesity rates of developed world. Second, Maasai culture. Men move with livestock to search for pasture about 2 weeks to 3 months. Thus, they need to limit their children adequate access to immediate animal products like milk. In addition, animals are highly valued and being kept for prestige. In their culture, it is not acceptable to slaughter animals unless during special occasions. This might lead to children to consume an inadequate amount of protein. They tend to serve their father first, while women and children eat after the father. The children might eat in calorie deficit, which can cause malnutrition problems. Thank you for watching. These are our group members. These are all the references we use in this video.